Good morning, everybody. It's very honor for me to have this opportunity to introduce my friend, my really good friend, Suthep Udomsawaengsup, right? My pronunciation is right? He's currently, he's a president of ELSA. I think actually we did not introduce him to you, you, our audience, because he's too famous for me to introduce here. Uh, but briefly, I introduce my friend Suthep. In short, he is now currently Associate Professor of Surgical Department of Surgery, Faculty of Medicine, Chulalongkorn University, Bangkok, Thailand. Very famous university. And he is the director, Chula Minimal Invasive Surgery Fellowship Training Program. And he's the director, Chula Bariatric and Metabolic Institute. And he's the director, Chula Minimally Invasive Surgery Center, Department of Surgery, Faculty of Medicine, Chulalongkorn University, Bangkok, Thailand. And also, he's another thing I can say, but for give him enough time for his lecture to all of us, please. Thank you very much for your accepting our proposal, please.
Good morning, ladies and gentlemen, dear KSL friends. Thank you for the invitation to join KSL 2020 Toward Perfect Goal. This is Dr. Suthep Udomsawaengsup from King Chulalongkorn Memorial Hospital, Chulalongkorn University, Bangkok, Thailand. My topic today is Laparoscopic training in soft cadaver. How do we have trained? First, I would like to bring our best regards from ELSA to KSL. And also as the president of ELSA 2019 committee, let me bring our great thankful to KSL for being the greatest support to ELSA 2019 at Chiang Mai. The 14th Asia Pacific Congress of ELSA has been very successful with all support from friends and colleagues. This year is unique, but for me, I still saw you. I miss beautiful view, and I wish that soon we'll be able to join in person again. Let me introduce to you the Chula Soft Cadaver Surgical Training Center. We are located in Bangkok, and if you have a look closely into the map, the area is Chulalongkorn University, and at the corner is King Chulalongkorn Memorial Hospital. The training center is located in Faculty of Medicine, Chulalongkorn University, which is located next to the hospital. From the aerial view, you see that we are surrounded by a very beautiful and in the central district of Bangkok, Thailand. That is Chulalongkorn University. At the corner, you will see King Chulalongkorn Memorial Hospital. Chulalongkorn University is the first university in Thailand since 1917. King Chulalongkorn Memorial Hospital was built in 1914 and it's part of the Thai Red Cross Society. Welcome to King Chulalongkorn Memorial Hospital. We are composed of the traditional, beautiful, and also high sky building. As we all know that laparoscopic surgery need to have a different skill, and those skills must be earned because we will be lack of 3D dimension And also the surgeon hands in the target organs will be separated. So eyes and hand coordination must be learned. We may learn from the box trainer. Let me introduce to you the T-Tech, where there's a place for setting up a training scale for box trainer or for wet lab and animal lab. So laparoscopic surgery also require a completely different skill than open. For new surgeon, basic laparoscopic skill must be developed. So we do have incorporate the basic laparoscopic skill development workshop for our residents. Luckily, and thanks for the those who donate themselves for the academic activity. Our soft cadaver is legally self-registered, donated for academic activity. It will be preserved and we can keep up to 12 months. We pay our highest respect to our cadaver and we will be grounded and get at time as we are doing our operation in our theater. In the end of the academic activity, those who donated themselves will be honored by the cremation ignition fire bestowed by the king. This was our first workshop done by our center. You'll see that it started with thyroidectomy endoscopically, was very successful. Then in 2007, we have our new training center, which accommodated with a 6 station for laparoscopic theater, but we can expand up to 48 stations. There are 2 lecture rooms that can accommodate 40 participants as well as a 100-seat meeting room. Hernia is very successful. Our hybrid hernia has been very well recognized. It combined between open and laparoscopy. So you can see from open and laparoscopy, you can earn the experience and also practice your skill in our cadaver. So we have done several workshops for participants to experience themselves in the real anatomy of our cadaver. Another interesting field is bariatric surgery, which has been introduced in 2006. We have friends, experts from all around the world to teach, to get experience to local surgeons as well as regional and global participants. We also have a good collaboration from KSL. For example, for last year, we have the Asia Bariatric Cadaver Workshop, which KSL have been giving us support. It was very successful. So let me introduce to you, this is the real view from our workshop. This is the laparoscopic sleeve gastrectomy. The participants themselves will be given the opportunity to practice like they are doing in the real cases. So the equipment, the energy sources will be provided, and this is sleeve gastrectomy. You will see that we started with the dissection, followed by the stapling device, which same as we are doing in our real cases. So we start with the green one, following with the blue, and then follow up to the angle of hairs. You will experience the tissue itself, also the anatomy. So the participant will be given the real experience, which we believe that this would be given or assure that the patient will be having benefit from. And this will share to you the Laparoscopic gastric bypass. So the participant will be experienced with the pouch creation with the real equipment. So see that they will create a pouch. After having a pouch created, we'll move down to the small ball part. Now you will notice that the momentum or the consistency of the bowel that has been preserved. It does look like the real in our case. We also provided the opportunity for the participant to try for the new or innovative procedure. For example, at the beginning of the gastric placation, we have our experience in our cadaver trying to replicate sleeve gastrectomy without any cut by placated the greater curvature. So we have tried several times in our cadaver up until our team has confidence. Then after having the IRB confirmed, we start our Laparoscopic gastric placation in our cases. Another benefit of the cadaver is that by this cadaver, when we start doing the transversus abdominis release or TAR technique or the posterior component separation, we experience ourselves in our cadaver. So we see that the tissue plane and the vessel or nerve will be presented. So we experience from open technique, we familiarize ourselves with the posterior abdominal wall anatomy, layer by layer. So you will see the fiber itself, the muscle fiber, still look very nearly like the muscle in our patient. So the great benefit of dissecting in our soft cadaver is that we can reveal the posterior anatomy of the abdominal wall that would lead us to the posterior component separation correctly. The nerve fiber and the vessel itself, it will be demonstrated. So we'll see now the transversus abdominis muscle is being separated. So we learn anatomy and we apply the technique. So this video I just would like to share to you the tissue and anatomy. So then after demonstrated the muscle, we separate the transversus abdominis into the preperitoneal space so that the correct plane of transversus abdominis release or TAR technique. We also apply Laparoscopic technique for TAR after having experience with the open one. Another basis of cadaver would be for a study. Anterior versus posterior component separation has been studied in our cadaver. We demonstrated that the posterior component separation as shown in this photo for the TAR open, you will see that it has a bigger advancement, and we do have to compare with the open anterior component, and you will see that the advancement of posterior components been more benefit. That's also part of our study. To respond to the COVID-19, resources and risk management, we are temporarily suspended our activity, especially during the high infected month, which was March and April, after we having the flattened out of the curve and lowered the number of cases. So we again resumed to our activity since late May and early June. You will see that we have had our cadaver lab with a very respect to social distancing. In this situation, we also launched the telementoring in our cadaver lab. So this would be beneficial to local participants to experience. So we get the support from experts from outside. Let's have a look with this workshop. Thanks our team, you will see that several IT equipment has been equipped. So we need to have the very high connection. And also, this would show that we can do telementoring.
Okay, so yeah.
I don't think that the balloon is so important. You have to dissect in a correct layer, and if you put the balloon in incorrect layer, you will destroy more. You can control it like this under insufflation of CO2. I can imagine you have a pressure intraabdomen.
Patubulum of the symphysis pubis down there. I think you all can appreciate the anatomy here, the pubic tubercle.
Absolutely perfect. I have to make a statement for the other participants. This is probably the very best way of preservation of the human tissue for this purpose. And when I saw
Cheer first.
Oh, okay, yeah, and I need to follow the lady again. The lady.
well, I called it endoabdominal fascia. Some people call it intermediate fascia, but it lies in front of the transversalis fascia.
I got you. Yeah.
Section. So I believe that the TEP technique is always oriented closer to the muscle, especially when you go laterally from the epigastric vessels. But we will come to this point.
Kandukan, any advice?
No.
The grasper is so much more exact than two graspers that most TEP surgeons are using.
Oh, I like
and I think vertically. And when you press from the outside, you will see whether there is a fatty tissue prolapsing from the canal, because the inguinal lipoma or the cord lipoma, which is actually the wrong denomination, because it's not the fat that runs with the cord. It
this section.
So what I have to thank is that we have Professor Kuketa from Switzerland to mentor me doing TEP in our cadaver. After having the demonstration, then we have our local expert so as our participant to experience with the real workshop. So for the telementoring, we believe that during this specific period of time which we are dealing with COVID-19, we are looking forward to the collaboration, especially for K-cells, and hopefully soon that we can do a bubble so we can exchange our experience and also we can welcome our friends back in our center again. So, ladies and gentlemen, Laparoscopic training in soft cadaver. How do we have trained? So we have for one real platform for Laparoscopic training. It is effective model for applying all Laparoscopic skill. It's available and also it's affordable. They might have some limitations, especially the real pathology, for example, hernia, which we have about 30% of our cadaver have had a hernia, or obese cadaver. We might have the limitation for the vessel dealing. Anyway, we can see the vessel very well. During the pandemic, the telementoring workshop has been established, and we are looking forward to the limited bubble traveling workshop where we can serve to our colleague from abroad. With all of my presentation, I would like to thank for your attention from Bangkok, Thailand, and I wish to see all of you in person soon. All the best to everyone. Thank you.
Oh, very good talk, and also very understandable. And also you introduce your facility very well. I think it's world top facility, right?
Thank you. We are part of it.
Your looks cadaver surgery looks like a real patient surgery, except bleeding.
You're right, exactly. No, thank you very much. First, I would like to congratulate KSOs and our KSO colleague for the successful initiative. And also thank you for the invitation for joining. Let me sharing our facility, and we wish soon in the future that we can travel and then I can host you here in Bangkok in our center.
How many Korean surgeons visit your facility, training center?
Yes, several. Mostly it will be our teacher, our mentor, and also some of them are participants. So we sharing both facility. So
yearly 100.
Probably because only my center it's about 30, but we do have several facility, several department who are also joining sharing the facility.
Mhm.
So I think because of you, Professor Kim, especially for colorectal team, they have learned from you, and then they practice in our cadaver, and then they, finally they are very keen in doing laparoscopy. So this is what we are developing in our laparoscopic practice in Thailand and in our region.
Yeah, also we, our Catholic University of Korea, try to learn how handle the soft cadaver system, and we try to set up just like your cadaver facility, but not like your system. But we also a lot developed because you give us a lot of good information and teaching how handle the cadaver system, cadaver, right? Thank you very much.
Thank you.
Also, our administrative team visit your cadaver workshop facility. Do you remember?
I do.
Yeah,
Yes.
3 years ago or 2 years ago, yeah, I remember.
Yes. Hopefully next year. Yes.
Any question from the audience? Because your message is too clear, so maybe no question from the audience.
Thank you. Let me express my regards from ELSA and also from Asia to KSLs. First, me as the committee, the chairman of ELSA 2019 committee, KSL friends are number one, the biggest supporter and also contributor to ELSA 2019. This is a beautiful, lovely friendship that we do have. Secondly, from ELSA, like now I'm a president of ELSA, I would like to congratulate KSLs for another successful KSL meeting, KSL 2020. Even it's virtual, but it's very informative and very attractive. Congratulations to KSLs.
Thank you. Do you know why? Your people is very good. Your surgeons is very good in human beings and as surgeons. Good people.
Yeah, thank you very much. Thank you. We are very happy to have you and our Poland friends with us. So that's why we are similar. You are we are saying that we are very appreciate friendship.
Have a good relation forever. Yeah. Thank you very much.
Thank you, 감사합니다, and have a good day.
Have a good day.
Pandemic, which we don't know when it's going to be finished. Now we also keeping our collaboration, especially maybe between Korea and us, so that we can do some tele-mentoring. You can sitting there and then you can teach your student here in Chulalongkorn. So hopefully soon we can establish that. We are looking forward to that opportunity. So you are invited. You are invited to join us for the tele-mentoring, and your student will be enjoying your lecture and also your mentor from the Korea.
Thank you very much. Yes.
Okay, thank you. Have a good day. Thank you.
Have a good day. Bye-bye. Yeah. Suthep.
Yes.
Do you know the Professor Yun-Gi?
Yes.
He said, say hello and give a best regard to you.
Oh, 감사합니다.
Yun-Gi's talk.
Yes.
Yun-Gi's message from here to you, right?
Yes. Thank you very much. I love to, yeah, it's lovely. It's lovely. Even we cannot meet in person, but meeting via the virtual meeting is also keeping us, happy. So thank you. Thank
Me
our
too.
friend. Thank our friend from
Thank you.
Korea.
Thank you.
Yes. Stay safe and healthy, and we'll see you soon.
Yeah, you should be healthy. We should be healthy, right? Bye-bye.
Yes. Thank you very much. Thank you.